Okay, so my dear friends, today we have a very important game today. In fact, we are going to give a commercial. We are going to make a TV commercial. Though we are in the class, sitting only over here, and we are just trying to teach you how the people speak in any kind of advertisement to endorse their product, to promote their product. Now, in the modern times, even the people are giving advertisement of hospitals, better hospitals. And we have over here good hospitals over here. People have gone there, they have got the benefit. And let's talk about a hospital which is required in our area, and we really do not have this kind of hospital in our area. Now people are really struggling for better treatment. They have to go to the big city hospitals, and they have to wait for a lot of time. It's a lot, and maybe they'll be getting the bed or not. That's a different factor. If the bed is not available, then nothing can be done. So number of beds definitely is a very big factor. Now today we have taken a fictitious name, definitely. It's an imaginary name, and the name which I have taken today is Holy Lord's Multi-Speciality Hospital, okay? And now, Holy Lord's Multi-Speciality Hospital. So, the advertisement will be giving the detailed information. The advertisement will be giving the detailed information about the hospital and every kind of facilities, every kind of technology which is going to benefit a particular patient is present in this hospital. It's a multi-specialty hospital. So the advertisement will be like this, okay? Ready? Just look at me and do not speak a word. Just watch me. If you're looking for a better hospital with the USA doctors and the Indian doctors in collaboration, and the nurses and the medicines, and all the modern facilities present to be present in one hospital near your area, it has to be the one and only the Holy Lord's Hospital. It's a multi-specialty hospital with the most modern technologies, and the USA doctors having the USA techniques, and in the field of medicine, in the field of medication, in the field of science and technology. And we got modern machines over here, and these modern machines can perform wonderful tasks, and it will be really perfect, absolutely perfect. There will be no mistake. Let it be blood test or let it be anything, So let me tell you about this Holy Lord's Multi-Speciality Hospitals in detail. First thing I want to tell you that as you enter the main gate, and you have to take the left turn, and you have to even just see the X-ray department is present over there. So you have any kind of bone fracture, and if you have any kind of hand fracture or anything, mostly the accident cases, they can come over here and immediately they will do the X-ray, okay? And according to the X-ray, the doctor will give you the medications, and they have to do the plaster, and whatever they have to do, they'll do. Now second comes the pathology department. The pathology is a very important department, because in this pathology department what happens, you need to do the blood test and the urine test, and many other tests are there, and which has to be done in the laboratory. And this test which is done in the laboratory has to be done very accurately. It has to be absolutely accurate. Even 0.00001% mistake cannot be tolerated, because the case can be different in that way. So what we have to do, pathology department over here of Lord's Hospital, Holy Lord's Hospital, is perfect, having the modern machines and the modern technologies, and every test will be perfect. Operation theatre is most important department, where the surgeries are done. Big surgeries are done. The surgeries can be stomach surgery, heart surgery, kidney surgery. God forbid, if you have any kind of problem, then this place is the right place for you. Even for the operations, they do not take a lot of money. They have a very, very lowest, low amount, very little amount, so that it can be afforded by the common people, and cheap and best. And second thing is that after the operation department, operation theatre, we come to the emergency department. Now, emergency department is interconnected with ICU and ICCU. Okay, intensive coronary care unit, patient, heart patients. All are in one particular area, that is called emergency department. And if any accident cases are coming, maybe bus accident, maybe train accident, or any damn accident, God forbid, but then they have to come to the emergency department, and the emergency department will be definitely taking the action instantly, spontaneously, promptly. And thereafter we go to the female ward. Number of seats 250 seats. All the seats are having, all the beds are beautiful beds, soft, good for the patient, big and wide, having all the modern facilities for intravenous saline or maybe blood bottles or whatever it is. All the facilities are given. Similarly, 250 female ward, 250 male ward, 250 beds, 500 beds total, 250 plus 250. And then we come to the kitchen department. Kitchen department plays a very important role because the patients need proper food as per the advice or prescription of the doctor. So food has to be perfect. Extra oil, extra sugar, extra salt. They have to be cautious about so many things, you see. So you have to be very, very careful. So the kitchen department, under the guidance of proper chef and nutritionist, they are giving their best advice, and they have to look after the cooking department, because every patient should be given proper food at proper time, in proper quantity. Proper food at proper time, in proper quantity. Next is USC department, ultrasonography. So people having stomach problem, they keep on complaining, I'm having stomach pain and all. Might be possible that there is a stone somewhere in your body, maybe in the gallbladder or anywhere, maybe in the kidney or somewhere. So in that case, what happens? You have to go for the ultrasonography. So they'll make a photo, they'll take picture, and finally they have high technology technical factors that are associated over here, and then USC is done. And according to the picture, doctor will prescribe what to do and what is not, what is to be done and what is not to be done. Then comes the CT scan, that is MRI. So your brain scanning is done. Suppose you have brain injury. In many of the cases we see motorcycle accident and people fall down simply, and if they fall down headlong, and then what happens? You get the impact on the head at first. So if your head hits the ground first, and ground is always hard, and you'll be receiving a bang, that creates internal hemorrhage. So maybe internal hemorrhage is there, maybe some bleeding is going on, or maybe something has been joggled up, or maybe big jerk has taken place. So maybe the thing has been removed from there. So these kind of things are definitely done by the big machines. Proper technicians are operating the machines in a proper method, in a proper protocol, proper manner according to the machine. Ambulance facilities or trauma car facilities you'll be getting from here. Ambulance means you'll be getting the ambulance 24/7, just give a call, and if the case is very serious, then you got trauma cars. In the case of trauma cars, it will be better for the patients who are really in a very delicate condition. If the patient is really in a very delicate condition, then definitely I think trauma cars are supposed to be sent to bring the patient from their house and to the hospital. So drivers are waiting for you, just give a call. Call numbers are all given over here. So, dear friends, any kind of problem you face as far as the medical facilities are concerned, remember, local area, in Rupnanpur area, Holy Lord's Multi-Speciality Hospital is there for you. It's new, with new facilities, new doctors, new brains, latest technology, that is Lord's Hospital, Holy Lord's Hospital. Please come if there is any problem. See the phone number. Thank you.